Monday, man gets PSA result. 5.2, elevated for his age. Immediately panics. Researches worst-case scenarios all week. Can't sleep. Obsesses over every symptom. Tells everyone. Cries. Fears death. Friday, can't take anxiety anymore. Goes to ER demanding immediate testing. ER orders blood work including repeat PSA. Result, 7.0. PSA jumped from 5.2 to 7.0 in 4 days. Doctors concerned. Order urgent urology consult. Discuss immediate biopsy. Urologist reviews case. Asks detailed questions. Discovers. Man had been in panic state all week. No sleep. Extreme stress. Constant worry. Urologist. Let's wait 2 weeks. Practice stress reduction. Then retest PSA. Man skeptical but agrees. Sees therapist. Starts meditation. Gets sleep. Calms down. 2 weeks later, PSA 5.4. The 7.0 was panic response. Stress hormones elevated PSA by 1.8 points. Study from Psychoneuroendocrinology. Acute psychological stress can elevate PSA by 10 to 30% within days. Today, why panic causes measurable harm, the physiological mechanisms, and the systematic rational approach that produces better outcomes. Now, before we move on, a quick reminder, this video is for educational purposes only. It's not medical advice, and elevated PSA absolutely requires proper medical evaluation. This video is not telling you to ignore elevated PSA, but rather how to respond to it in ways that support rather than undermine your health during the evaluation process. And if you'd like a free PSA anxiety management guide, just comment the word "calm" below. You'll find the link waiting in the pinned comment. It's a simple guide with evidence-based strategies for managing anxiety during medical uncertainty. Now, let's understand why panic is physiologically harmful and what to do instead. Let's start with the science of how panic actually raises PSA levels. Study from Brain Behavior and Immunity. Psychological stress increases inflammatory markers in bloodstream within hours to days. Specifically, cortisol, the stress hormone, triggers inflammatory cascade. Inflammation markers that rise with stress include C-reactive protein and interleukin-6. Research from Prostate Journal. These same inflammatory markers correlate directly with PSA elevation. Men with elevated CRP, PSA average 1.4 points higher than men with normal CRP. Men with elevated IL-6, PSA average 1.6 points higher. The pathway? Stress, cortisol release, systemic inflammation, prostate inflammation, PSA elevation. This is not psychological. This is measurable physiological response. Study from Journal of Urology. Men with high anxiety levels after elevated PSA diagnosis had PSA readings average 1.2 points higher than men with low anxiety when both groups retested after stress management. Real-world example from opening, man's PSA 5.2 became 7.0 under extreme stress. Returned to 5.4 after calming down. The 5.2 was his baseline with existing prostate condition. The additional 1.8 points were pure stress response. When he reduced stress, stress-induced elevation resolved. This creates vicious cycle. Elevated PSA triggers panic. Panic raises PSA further. Higher PSA increases panic. Each cycle makes situation appear worse than it is. Breaking cycle requires understanding. Your anxiety response is adding to the number you're anxious about. Second mechanism of harm, panic suppresses immune function. Study from Psychosomatic Medicine. 1 week of severe psychological stress reduces natural killer cell activity by average 43%. Natural killer cells are your immune system's cancer surveillance team. They identify and destroy abnormal cells, including cancer cells. When NK cell activity drops 43%, your immune system's ability to detect and eliminate cancer cells is significantly impaired. Research from Brain Behavior and Immunity. Chronic stress also reduces T-cell function and antibody production. The irony? If you're panicking about possible cancer, you're actively suppressing the immune system components that fight cancer. Additionally, stress hormones create pro-inflammatory environment. Inflammation can promote cancer cell growth. Study from Journal of Clinical Oncology. Cancer patients with high anxiety and depression had worse treatment outcomes than patients with low anxiety, independent of cancer stage or treatment type. The mechanism: chronic stress, immune suppression, reduced cancer surveillance, increased inflammation, worse health outcomes. This doesn't happen in one day. But week after week of panic takes measurable toll on immune function. Your body needs immune system functioning optimally during medical evaluation and any potential treatment. Panic undermines exactly what you need most. Third mechanism of harm. Panic impairs decision-making ability. Research from medical decision-making. Decisions made under acute anxiety have significantly higher regret rates than decisions made after anxiety reduction and deliberate consideration. Study from Journal of Clinical Oncology examined treatment regret in prostate cancer patients. Men who chose immediate aggressive treatment while highly anxious. 47% reported moderate to severe regret within 5 years. Men who took time for anxiety management and systematic evaluation before deciding, 11% regret. Why does panic impair decisions? Panic narrows cognitive focus. You fixate on single aspect, cancer or elevated number, ignore broader context, cancer grade, growth rate, treatment side effects, quality of life impacts. Panic creates false urgency. You feel need to act immediately, reject watchful waiting even when medically appropriate. Panic prioritizes emotional relief over long-term outcomes. Just do something feels like taking control. But rushed action, often not optimal action. Research from European Urology. Men who took 8 or more weeks between diagnosis and treatment decision had better alignment between treatment choice and personal values than men who decided within 2 weeks. Time allows anxiety to decrease naturally, information to be processed thoroughly, values to be clarified, multiple opinions to be gathered, real-world consequence. Man panics, demands immediate biopsy and treatment, chooses radical surgery, lives with permanent incontinence and erectile dysfunction. Later learns cancer was so slow-growing, he likely never needed treatment. This scenario plays out thousands of times. Preventable with anxiety management and systematic evaluation. Let's establish facts to counter panic-inducing assumptions. Fact 1. Elevated PSA does not mean cancer. Study from New England Journal of Medicine. Among men with PSA between 4.0 and 10.0 who underwent biopsy, 75% had no cancer. 3/4 of elevated readings are false alarms from benign conditions. Benign prostatic hyperplasia, prostate inflammation, recent activities like exercise or ejaculation, age-related changes. All can elevate PSA without cancer being present. Fact 2, even when cancer present, usually not aggressive. Research from Journal of Clinical Oncology. 87% of prostate cancers detected by PSA screening are low-grade, slow-growing. Average time from detection to symptoms, if untreated, over 10 years. This is not emergency requiring immediate intervention. Fact 3, you have time for systematic evaluation. Elevated PSA is starting point for investigation. Not diagnosis, not death sentence. Proper evaluation includes repeat PSA testing to confirm elevation, digital rectal exam, possible MRI imaging, possible biopsy if other findings concerning. This process takes weeks to months, deliberately, because rushing serves no medical purpose for slow-growing conditions. Fact 4, many men live full lives with elevated PSA and never develop problems. Study from Scandinavian Prostate Cancer Group. Among men with low-grade prostate cancer who chose active surveillance, 94% survived 10 years without needing treatment. These facts don't eliminate need for evaluation. They eliminate need for panic. Attention? Yes. Systematic follow-up? Absolutely. Catastrophic thinking? Medically counterproductive. Beyond PSA, immune function, and decision-making, panic creates cascade of health problems. Sleep disruption. Study from sleep medicine. Anxiety about medical test results causes average sleep reduction of 90 minutes nightly. Chronic sleep deprivation impairs immune function, cognitive performance, cardiovascular health, metabolic function, blood pressure elevation. Research from Hypertension Journal. Health anxiety can elevate blood pressure 10 to 20 points systolic. Sustained elevation increases heart attack and stroke risk. Digestive problems. Stress affects gut function, creates or worsens acid reflux, irritable bowel, appetite changes, weight changes. Anxiety causes weight loss in some people, stress, eating in others. Either extreme stress is body, relationship strain, obsessive worry, emotional volatility, withdrawal, create tension with spouse, family, friends, work impairment, difficulty concentrating, errors increase, productivity drops. Some men miss work or lose jobs from anxiety. Study from Health Psychology compared health outcomes during 3-month evaluation period. High anxiety men, average weight change 8 pounds, sleep quality poor, blood pressure elevated, relationship satisfaction declined, work productivity decreased. Low anxiety men, minimal changes in these measures despite same medical uncertainty, same elevated PSA, same need for evaluation, completely different health impacts based on anxiety management. The evaluation period itself becomes health crisis for high anxiety individuals, remains manageable for those who maintain calm. So what's the appropriate response to elevated PSA? Step 1. Acknowledge the concern. Elevated PSA warrants medical attention. This is rational, not panic. Step 2. Understand the timeline. PSA evaluation is process, not emergency. Most cases allow weeks to months for thorough assessment. Step 3. Avoid catastrophic thinking. Don't jump from elevated PSA to death. Most elevated PSA is not cancer. Most prostate cancer is slow growing. Step 4. Implement stress management immediately, not after evaluation. Now, techniques proven effective. Deep breathing exercises, meditation or mindfulness practice, regular physical activity, adequate sleep prioritization, limiting online research to reputable sources only, talking with therapist or counselor. Study from psychosomatic medicine. Men who used structured stress management during prostate cancer evaluation had 41% lower anxiety scores and better quality of life than men who didn't. Step 5. Follow systematic medical evaluation. Repeat PSA to confirm. Imaging if indicated. Biopsy only if multiple factors concerning. Get second opinion if recommendations unclear. Take time to understand options. Research from Annals of Internal Medicine. Systematic evaluation catches cancers needing treatment while avoiding overtreatment of indolent cancers. Step 6. Make decisions from clarity, not fear. If cancer found, understand grade and growth rate. Explore all options. Active surveillance, surgery, radiation, other treatments. Match treatment intensity to cancer aggressiveness. Don't use sledgehammer for problem requiring scalpel. Study from Journal of Urology. Men who made treatment decisions after anxiety management and thorough evaluation had 92% satisfaction with their choice at 5 years. Those who rushed to treatment from panic, 63% satisfaction. The process: acknowledge, evaluate systematically, manage anxiety actively, decide deliberately. This approach serves your health. Panic undermines it. Let's return to core message. Your response to elevated PSA affects your health as much as the PSA itself. Panic response raises PSA further through stress hormones, suppresses immune function, impairs sleep, blood pressure, relationships, work, creates rushed decisions leading to regret. Measured response allows accurate PSA assessment, maintains immune function, preserves quality of life during evaluation, enables thoughtful decisions aligned with your values. The medical evaluation is same either way, but your health during and after evaluation depends entirely on which response you choose. Study from Cancer Journal. Men who managed anxiety during cancer workup had better long-term mental health outcomes, regardless of whether cancer was found, because anxiety itself is health threat, independent of medical findings. Elevated PSA requires medical evaluation, not panic, attention to your health, not destruction of your well-being, systematic investigation, not catastrophic assumption. You control your response. You cannot always control the medical outcome, but you always control how you navigate the process. Remember, comment calm for your free anxiety management guide. If this perspective was helpful, tap like and share with men facing elevated PSA. Subscribe because next week we're covering the systematic PSA evaluation process step by step, so you know exactly what to expect. 75% of elevated PSA is not cancer. 87% of PSA detected cancer is slow growing. You have time. Use that time to support your health, not destroy it with panic. Elevated PSA is medical information requiring evaluation, not emergency requiring panic. Your measured response, your preserved health, your informed decisions.